IBS, which is an abbreviation for Irritable Bowel Syndrome, is one of the most common functional gastrointestinal disorders, and it is characterized by a combination of abdominal pain and altered bowel habits. It is very common in the population. Approximately 15% in the general population suffers from IBS, and it's not from a medical point of view, it's not a serious disease. You will never die from IBS, but it affects the life of the sufferers quite substantially. It reduces quality of life, it reduces work productivity, and it affects their general life very much. The relationship between gut microbiota and irritable bowel syndrome is currently being explored. There are some studies that have demonstrated an altered composition of the normal gut flora in patients with IBS compared with healthy controls. We still don't really know how important it is for IBS, but we believe that it is important at least for a subset of patients, and that we can probably affect the symptoms by treating these gut microbiota alterations in IBS patients. There are currently different approaches to modulate the gut microbiota in order to treat the symptoms. The first thing that you can think of when you think of modulating gut microbiota to treat symptoms is to use antibiotics, and then it's antibiotics that are not absorbed up into the body, but just passes through the gastrointestinal tract. So it affects the gut microbiota only and not microbiota in other places in the body, and that by doing that you can improve symptoms. The second approach could be to use good bacteria, that is probiotics that can be delivered in dairy products, for instance, or in capsules, and you can use that to modulate the gut microbiota composition and then to treat the symptoms in that way. The third way is to use diet, to change the diet, to change the gut microbiota composition, and by doing that you can also improve the symptoms. So these are the three ways that are currently being explored to treat irritable bowel syndrome symptoms by modulating gut microbiota.